My
3, 2,
goodness.
1.
How about that?
Congratulations, sir. You got your third.
Yeah, I felt it going in, and I didn't even feel
I
it
don't
after
like
that.
for you to
so
feel it.
that was it. Just like a tickle, really.
Just like a tickle. Okay. Well, just about an hour ago, Governor Jared Polis received his booster shot of the COVID-19 vaccine. This is his third dose of the Moderna, and this comes a day after the CDC cleared the way for distribution of boosters for Moderna and Johnson & Johnson across the country. It's been a little confusion, though, about when it comes to what the CDC is actually recommending here. So to help us work through that, 9 Health expert Dr. Payal Kohli, happy Friday. Thanks for coming.
Happy Friday. Thank you.
There is a little mixed messaging confusion here because Governor Polis is really gung-ho about these boosters, but the CDC has some really specific guidance. Just one more time, remind us, what does the CDC say we're doing on boosters?
So the CDC and the science says that only a subset of people are most likely to benefit the most from the boosters. Those are individuals over the age of 65 because their immune response is probably blunted and they maybe didn't make as many antibodies the first time. Individuals under 65 who either have a high-risk occupation or a high-risk living situation, like they live in a long-term healthcare facility. And then, interestingly, anyone over the age of 18 who received the Johnson & Johnson single-dose vaccine should go and get a second one if they're at least 2 months out.
Okay, so those folks, if you just got it, go, as opposed to if you fit another set of qualifications, really.
That's right. The messenger RNA one's at least 6 months out, but Johnson & Johnson 2 months.
Okay, what if you don't fit under one of these qualifications, but you're nervous and you like the extra protection idea? Good idea, bad idea to just go get it. People are thinking about this.
Ton of people, a lot of my friends are asking me the same question. I would say go and get it. Assuming a few caveats are met. Number one, that you've had enough time since your second shot. So you don't want to go and get it right away because it's really not going to do much. Number two, you didn't really have any adverse reactions to the first 2 shots, because if you had an adverse reaction, then you may want to talk to your doctor if you're not in one of those high-risk groups to go and get it. And then number 3, you want to make sure you don't get more than 1 booster. Some people have asked me this as well. If they continue to get many boosters, are they going to keep boosting? That's not how it works. So you really want to make sure you only get 1 and don't go and get multiple boosters.
Each time we get to the next phase, though, we're waiting on guidance, right? So don't be just jumping in line and getting every booster you can get.
That's
Guys,
exactly
don't
right.
do that.
But it is coming. I've heard rumblings that the CDC and the FDA are going to meet to talk about opening up boosters to everyone over the age of 40, really suggesting, I think, a philosophy shift, showing that the boosters help us fight the infection. The infection is continuing to persist, so we really need to increase our immunity against it.
Something else we learned from the CDC is what we do with the mixing and matching of doses. So that it depends, really, on what your first dose was. So let's talk through what we know about mixing and matching. And if you're getting a booster of the J&J, the next booster, there's something specific to listen to here.
Yes, so the CDC says anyone can get anything. I would simplify that a little bit. If you got J&J, go and get a messenger RNA booster, because we have shown that that has better efficacy than repeating with the second J&J, especially here because we have the luxury of having the option of multiple choices. If you got a Pfizer, you're basically going to get the exact same third shot as your booster. If you got a Moderna, you're actually going to get a half dose as your booster. So if you got a messenger RNA family vaccine, it doesn't make much sense to switch. I would say stay within the same family. You don't want to do the opposite. You don't want to switch from a messenger RNA to a J&J.
Okay.
So if you got Pfizer or Moderna, you want to get a Pfizer or Moderna booster.
It's a lot to keep straight.
It really is.
Thank you for helping us.
My pleasure.
Try to sort through all this. Dr. Payal Kohli, our 9 Health expert, joining us on a Friday. Have a good weekend.
You too. Thank you, Jenny.
All right. And now kids ages 5 to 11, they could be getting their first dose of the COVID-19 vaccine pretty soon. Pfizer announced today their child-sized doses of the vaccine are more than 90% effective in kids of that age group. Those doses are 1/3 the size of the adult version of the vaccine. Pfizer has concluded the shots are safe and they are effective in preventing severe COVID-19 in kids, again, ages 5 to 11. The FDA will be reviewing Pfizer's data and then will make a recommendation, likely sometime next week. And then the CDC must conduct its own review and give its approval before the vaccines can be rolled out to the greater public.